Hi everyone, welcome back to Med Unplugged. I'm Nouriye Amer.
I'm Sana Sharaf.
And I'm Azim Ahmad.
This is the podcast where we have real, unfiltered conversations about medicine, the things people don't talk about enough, the myths that never seem to go away, and the topics that actually matter.
Today, we are joined by Dr. Salman Abdulaziz, a renowned consultant in cardiovascular and intensive care whose expertise and dedication to advocating for health has made a significant impact in the medical community. Welcome, Dr. Salman Abdulaziz.
Yeah, thank you very much, and thank you for your hospitality, and I'm very proud to be here.
So, Dr. Salman, just to begin, I was wondering what are the most intense situations that you faced in the ICU?
So, apparently, our practice is more intense than others, in medical field. Um, in the intensive care unit, we deal with very critical cases. However, the most intense one is dealing with someone who is dying and you cannot, save the life of the patient. That's because of maybe we tried or attempts to survive him. Maybe that is not salvageable from the beginning. And of course, you have to face the reality and talk to the family about, breaking bad news and how to approach end of life management.
So, have you ever had to make a decision that could change a patient's fate, and how did that feel?
Well, we always make sudden decisions, And critical care, we face sudden events and we have to decide immediately accordingly. So, one of them is, if we have a cardiac arrest, you should decide now, how to, to save the patient life and what are the steps of resuscitation that you should follow. Every case has different chapter, and you have to follow the chapter that you are seeing the patient is going for.
Okay, what is it like to see a patient come back to life, and could you describe that experience?
Yeah, of course, feel so happy if someone is back to life and the patient is talking and walking, and patient is going home, interacting with his family. So all of this make us happy.
Before you bring them back to life, do you ever feel like there's a lot of pressure, when they're, to say, flatlining?
Of course, this is a pressure situation or pressurized situation. However, we adapt to stressful situations, because if we lose control, everything will be chaotic and you are not going to save anyone.
So, how would you cope with this emotional roller coaster that comes with working in this high pressure environment?
At work, you have to uh, organize the team. You have to undergo a couple of training sessions to different case scenarios that are very stressful. So once and twice the situation is repeated, the third time, of course, is going to be less stressful. A second thing is we have also to adapt our life to stress and get out of the circuit by enjoying life outside with family, friends, and of course, we should have our fun time. So we have to get out of the stress circuit as much as we can.
So, as a doctor who is very serious from the outside, what would you say is your more fun side? What do you do in your free time?
Well, I enjoy life.
What else?
Are there any sports you enjoy?
Mhm.
Are there any sports you enjoy?
Yeah. So I enjoy time with family. I enjoy time with my friends. I hang out for traveling, and I go for some trips, private trips. Yeah.
And you like football?
Yeah, of course, definitely.
So
What-
you would say all the stuff that you do outside of being a doctor would actually kind of helps you keep a balance?
Yeah, of course. Okay. So you know that there is a quote: "Life without fun is like an empty music box." So you should keep your box full of music to keep yourself happy.
What's your favorite football team?
FC Barcelona, definitely yes.
Yeah.
It's a dream team, right?
Yeah.
Yeah, even my brother supports them.
I mean, I don't really watch football. I don't really watch many sports, but if I had to say a sport I was into, it'd probably be swimming.
So you're supposed to be a good swimmer.
Yeah,
Okay.
supposed to.
The first time they throw you for swimming in the swimming pool or the sea or the beach, I think you were so stressed. But later on, you adapted, and everyone was supporting you to be a good swimmer, right? So this is the same thing that when you face at life or in life, you will be a good swimmer after a lot of many experiences.
So you could just go back to what you were saying earlier about how, this after the first and second and third time of being in certain situations that are stressful, you start to get more used to it. So do you think some of the worries you have when facing certain cases starts to disappear as you gain more experience? Because that's something that I personally think a lot about. Like, what if when I become a doctor, people's lives are relying on what I do and how I respond to situations.
Yeah, that's true. So at the beginning of your career, you are going to be having a lot of stress, okay, and more with extra training, extra specialized courses. You'll be more confident how to deal with patients and how to deal with the stress of patients and how to deal with catastrophic events when they are having. So when I advise, of course, this is well known in psychiatry to adapt to uh, phobic phenomena. You need to expose yourself, okay, once, twice, then all these stress will disappear. So there will be no more phobia. And of course, this is what you are gonna do at the beginning of someone career who is newly graduated. They are always under supervision, and there is always feedback after each stressful situation, how to adapt with the situation. Yeah.
So, Dr. Salman, you're an ECMO lead. So, could you explain to us what ECMO is and your role as an ECMO lead?
So ECMO stands for extracorporeal membrane oxygenator. All right. This is a small machine. In the past, it was so big. Now, with the advancement of knowledge and technology and manufacturing, this machine, in layman language, is working like an artificial heart, an artificial lung. So the heart stops or the heart is not working well with the terms and conditions that the patient fits. Okay, we connect the patient to this machine, which is called ECMO. At the same time, if the lung is not working well and the breathing machine is not supporting enough, and the patient has all the terms and criteria for, having this option, okay, we deploy the ECMO machine to support the lungs. So it's either we put this machine to support the lungs or the heart as a bridge for recovery, or if there is no exit, maybe the patient will be a candidate for either lung transplant or heart transplant. So this is so complex. However, that's what I can explain to you, that this is a life-saving machine, and it's a rescue way for a bridging for another life.
Does the ECMO replace the function of the heart or lungs, or is it just like a support system?
Temporarily, yes. Okay. Till, sometimes the heart is recovering or the lungs are recovering, or maybe the heart is not going to recover. So there should be another discussion with heart surgeons or cardiac surgeons. Is this patient candidate for heart transplant or not? So if the patient is candidate for heart transplant, they list him for another way of heart supporting machine and maybe later heart transplant. Same thing, if the lungs are not recovering and the patient fits the criteria, and the lung surgeon is happy with the criteria that are fitting for the patient to be a candidate for lung transplant, they will do lung transplant.
So, are these machines readily available around the world, or is this a new technology?
As it was an old, but it is new now, all right? So the first case of success of this machine to save a patient was in 1971, okay, for adult patient post trauma. He developed, severe clots, okay, and the lung arteries, and he was supported by this, operated, and then he survived, went home. In 1971, okay, 1975, the first newborn was successfully rescued by ECMO after, meconium aspiration. That's what they call it, meconium aspiration. So lung failure,
Okay.
and the patient is still alive. All right, and she already finished her college studies, and she's working in the United States.
That's amazing.
Now, okay, with the development of manufacturing, so the machine is very small and handy. You can walk with it anywhere, not necessarily in the hospital. You can go with the machine anywhere. Okay, you have to have very intense training to know how to deal with the machine. You have to have a full team to support you. All right, and it's not one man show or one single doctor show.
Yeah.
So, is this something you use regularly in your practice?
We use it often, okay, but not regularly, every day. We need it to rescue high risk patients
So this is only in like the more severe cases.
and very severe cases, yes.
You are also now an ELSO trainer. So could you explain what ELSO is and what your role is as a trainer?
So, ELSO is the Extracorporeal Life Support Organization. It's based in the United States, and there are branches of this organization in the continents. Is a collection of the elite experts, okay, in the ECMO field. They are putting uh, the base of guidelines how to practice on ECMO. They are sharing experiences. They are doing a lot of massive education worldwide to build up the experience among the physicians that are working in the field of ECMO. And how to be a trainer, of course. So I was trained to practice on this, but I need to be a trainer, means that they built up this education skills, how to deliver excellent courses and workshops for the candidates who are eligible to be in the ECMO field in the future.
So, we know before you became a cardiovascular critical care consultant, you were a consultant of internal medicine. So, would you say practicing internal medicine is much more of a calmer experience?
So the career of any physician should starts after the medical school, and you have the option to choose where you should go. I decided to go for internal medicine at the start, and I did my training for 4 years in this field. I had 3 certificates for this specialty. However, uh, if you want to proceed further, of course, you have to pay more effort to study hard and to practice hard as well. So I decided to go for first medical, surgical, critical care, and later on I chose to be in the cardiovascular critical care, which is more stressful. You want to have your honeymoon and enjoy life. Of course, internal medicine is more superficial than going for, caring of patients with cardiac problems, before surgery or after surgery. In cardiovascular critical care, you deal with a lot of complex machines to support the heart, and you'll see a lot of successful and sad stories together. There will be some trauma in the work. However, internal medicine is, of course, more calm.
Yeah.
You can practice at the clinic, all right, at any time.
So, following on that, how would you say your role in cardiovascular critical care differs from a general ICU doctor?
So, general ICU, they are taking care of medical and surgical ICU cases, whether complicated pneumonias, complicated infections, lung failure, kidney failure, liver failure. But we are more subspecialized, okay, and we take care of the heart as a priority, and then anything related to the heart, we support the organs, okay, by whatever machines. So we always look to the organs. Everyone is feeling we should support the organ by another machine, okay, till the patient recovers, or sometimes we fail because there are limitations for any practitioners in the medical field. And, we are not gods, right? However, we try our best.
Now, I know that you're subspecialized, but do you still look at any other types of cases in the ICU that doesn't relate to the heart or the lungs, or is that just
Well, I practice all what I studied in the past. So I practice internal medicine, I practice medical surgical ICU, and I practice also cardiac ICU. I practice ECMO altogether.
so it's all a combination?
Yeah, 5 certificates, 1 salary.
And to lead on that, we were wondering because you've talked about the ECMO, we're wondering how has technology changed cardiovascular critical care over the years, and just not cardiovascular critical care, but like in general in medicine. How has the development of technology changed medicine?
Well, of course, there is a huge revolution in this field, and machines in the past, not like now. So we can see everything is digital, everything is upgraded by artificial intelligence as well. And, the size of the machines in the past was so huge. Now you are having just, compact machines that you can move with them wherever you go, regardless in the hospital or outside the hospital. Uh, there are what we call ICU without walls, and sometimes we have mobile ICU, and sometimes we are creating our ICU in the airplanes as well. So we are open and we can function at anywhere.
So, how do you hope to change the future of medicine with the experiences and lessons you've learned?
Well, we always transform the experiences to another way. Either we write the stories that we face, and as a medical science, to be read by physicians and students. And sometimes we also show our success stories and challenges that we face in medical conferences. So we transform our knowledge into verbal knowledge that everyone hears.
Yeah.
So they are it, and they are very efficient to do.
And what legacy do you want to leave behind in the world of critical care?
Well, we create a ground of excellence for exchanging knowledge, and also we like to, create excellent physicians and leaders in critical care in the future, and we see them so successful.
So a lot of it is passing on what you know to the upcoming doctors and physicians.
Yes.
Like us.
Oh, yeah. Good luck for you.
Okay, so if you could summarize our episode today in 3 words, what words would they be?
Well, intensive care is very intensive, all right, and very stressful. However, uh, if you start building up your basics of practice very well in a strong, solid base, you will be a successful intensivist in the future. and you are not going to face all these challenges unless you are not uh, well certified or well trained.
So that's it for today's episode. Big thanks to Dr. Salman Abdulaziz for coming on and having such a great conversation.